What if I wake up and hate my results?
Call Dr. Bharti immediately, even if it's at 1 a.m. Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Kortesis.
And I'm Gaurav Bharti. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week.
All right, everybody. So good to see everyone. We're going to do a fun little series that we're going to kick off where you can kind of ask and answer, questions that keep patients up at night when they're contemplating or they're going to actually have a procedure. And, there's a certain level of anxiety that comes with, thinking about doing something for yourself from an aesthetic standpoint and from a standpoint of risk, worries, and like Bill, you and I both have been there kind of thinking about these things because, all of us have had little stuff done. And we're going to go through some questions and kind of give you some kind of thoughts on how you can deal with those concerns or anxieties.
It's interesting. I always ask my patients, how many crazy dreams have you had about the surgery prior to doing it? It's like, it's amazing that your subconscious produces things in dreams all the time because they're thinking about it constantly.
All right, Bill. First, one question for you. How scary is anesthesia really?
I've had surgery. I'm a control freak. People that know me know that I'm a control freak. And it's very difficult if you're a control freak to undergo general anesthesia and let go. But what I realized is, and what calmed me down personally was, these individuals do this every day, all day. We see it all day, every day. Patients do extremely well. They go to sleep. They wake up. They do great. General anesthesia is very safe. Now, are there complications? Are there risks? There's always risks. There's always potential complications. But that being said, those are few and far between. Anesthesia is safe. We do it all the time. The providers do it all the time. It is safe to do. No problems. Nothing to worry about.
Yeah, and I would say it's crazy when you get it. It's like you get it, and you wake up, and it's done. I mean, it's remarkable, to be honest with you. But it's okay to be scared and worried, and that's normal. I think anytime we don't have patients who's scared and worried about getting anesthesia, I'm like, what's going on here? So anyway, what's next?
Do implants flip, and should I be worried about them?
Yes, implants can flip, and they do flip, and I think you should be worried about it. Anything that can happen, but the truth is, with the techniques that we do now, you minimize the issue. The thing about implants flipping are twofold. One is you got a pocket that's too big and an implant that's just sloshing around in there. Okay, so that could be one reason. The other is that the implant is the highest cohesivity level, meaning that implant is very firm, and some of the implants have kind of a flat back and a round front. And so if it flips, your breast shape's going to change, and you can see it. So actually, the softer the implant, the less likely that you'll ever know that an implant's flipped. The firmer the implant, the more likely.
But it happens. I've seen it with mammography too. I literally just had a patient and said, "Hey, something's off. I just had my mammogram done. I don't know what's up." And I'm like, "Hey, do me a favor, kind of do this maneuver." And I flipped it back for her. She's like, "Oh my God, you fixed it.
Yeah,
you fixed it. You can't believe you just fixed it like that." And I'm like, "Yeah, it happened. It was just upside down." So they do happen. IAG, am I going to regret this later? Regret to be on this podcast with you, but
with me, no. With you, I don't know, maybe. No, I will say, I'll be really honest. It's very, very unlikely for you to regret having an aesthetic surgical procedure, at least with a high quality surgeon like anyone who's a part of HKB, because the thing is, you have to go through so much rigmarole to get ready. You're not just gonna on a whim do a big invasive intervention.
I will tell you, do your homework.
Yeah.
Go with a provider who does this all the time. Make sure you've communicated what you're looking for, what expectations are, and then there should be no regrets afterwards, right? If you go with an ethical plastic surgeon who's just going to do a good job, they'll take care of you. And the off chance you have a complication, they'll fix you. They'll
Yeah,
take
and
care of it.
I would say if there's something you don't like or you're unhappy with, then you have to use your voice, talk to your surgeon. They want to know, we want to know, and it can get addressed. All right, Bill, how do you know when enough filler is enough?
Oh, I think it's pretty obvious. If you can see somebody across the room and they look off, they're off because they have had too much filler. I'm a less is more kind of guy when it comes to filler. I know there a lot of injectors are out there. It's like, oh, you need a lot, you need a lot, you need a lot. I think you need enough, but not too much. And I just wouldn't go crazy. For me, it's a conservative approach. How do you
Yeah, I
address
agree.
it?
I think that the most important thing is you can't be a one trick pony, meaning you can't just keep filling somebody up. And so now with the advanced techniques and the differential product selection, which what I mean by that is, great skincare regimen using HA fillers, but also using biostimulators like Sculptra, aka PLLA, and Radiesse, calcium hydroxyapatite, and other biostimulators that are coming, including autologous fat grafting, PRF, PRP, recombinant PDGF. There's all kinds of tools that can be used to get you to a point where you have an elegant facial aesthetic. You don't have to be a super full face, but you can have fullness delivered with thickened collagen production and thickened skin constituents.
I think you're spot on. I think it's a better overall approach that we need to focus on versus, hey, I'm just going to do filler. You need to be on skincare. You need to do microneedling, hydrofacials, proper laser stuff, and some filler, and your neurotoxin of choice, right? And I think that goes a long way.
Yeah, it's like a multimodal approach. Lots of little hits here and there, not just one knockout usually.
Hey, G, should we all be on Ozempic or GLP-1s?
No, I don't think so. But I might differ from others. I think that it's the overwhelming high volume of patients would greatly benefit from it, but like me, I would not benefit from it at all. Like I'm already scrawny.
You need fat
like I
on
need
your
to
body.
eat.
But let's talk about the obesity issue in the U.S. right now. Vast majority of individuals are obese. We live a sedentary lifestyle. We eat poorly. I think GLPs are a good answer for a lot of those individuals.
It's a piece of it, right? It's a piece of the puzzle, but it's not the absolute solution.
But we now understand it's got a bunch of potential benefits, but it doesn't take away proper diet, nutrition, and working out.
But when you combine it with that, it's ridiculous.
Game changer.
I mean, it's insane. I think that it's a really incredible, and I guess what's really special is about the advancements that's happening in those. Like where these newer generation ones are way more targeted. The downstream side effects, like huge horrible muscle wasting, is virtually being eliminated.
If you have to work out and you have to eat enough protein in order to build muscle, so otherwise, like you're toast.
So it's very remarkable. God forbid hopefully we don't see any kind of horrible downstream other side effect. That's the only thing that keeps me up at night when I see something that's being rapidly adopted that's fairly new and current. I think there's always a potential side effect from anything you take. I'm the type of guy, I love synthetic stuff. I love protein. I love bars. I love all the crazy synthetic stuff. But unfortunately, I tend to respond poorly to them. And so I have to be careful taking anything that's non-natural. And so it's been a tough battle for me, like where even I'm not taking any peptides or any synthetic protein just because I had some funny labs. And so now I've basically stopped everything and now I'm going to add stuff back. So I think people need to be very cautious and cognizant of their health and when they're trying to improve their health and do it in a way that's, with support and do it with purpose. And then also to monitor what they're doing because we're all different. That's the amazing thing about humans and animals and, this earth we live in. We're all just a little different. And so we all might respond to things differently. And so I think, this, like the way that healthcare is evolving, we're starting to take care of each individual as an individual versus like, all right, you take 50 milligrams of Lipitor and blah, blah, blah of metoprolol. And they're not making any adjustments for weight.
We got to move away from this disease to treatment situation that we have in the U.S. I think we need to move to this model of preventative healthcare and really take care of ourselves and do the right things.
All right, we digressed. What if I wake up and hate my results?
call Dr. Bharti immediately, even if it's a 1 a.m. No, I think you just need to have an honest discussion with your surgeon. Right. It could be just swelling that happens. They're always called for instance, in breast surgery, there's a roller coaster that occurs with augmentation. Love them. They're going to be too big, too small. Oh, they're just right. It happens. Like there's odd swelling that's occurring. So 1, take a deep breath. 2, have an honest conversation with your surgeon. They'll talk you through it and say, hey, this is okay. This is not okay. Or no, we can switch it. And in the end, if you're not happy, everything can be adjusted.
Yep.
Everything can be adjusted and fixed.
One thing I would say is that the post-surgical blues are real, and it hits people in different ways. It can happen like right after, or it can happen a week or 2 later, or when it's like getting in the way of your lifestyle, it can happen, or if you have a bunch of swelling, or you have like a little fluid collection. So I think those things are real, and patients need to be educated on the front end that, hey, you're going to have you may have a down day or a couple down days. When you have those days, know that it's okay, and then also reach out, call, just so we can help you and walk you through it, because sometimes that really can be hard, and the mind is a powerful thing, and sometimes when the mind gets in a dark place, it really makes things harder, and when you're beat up surgically and recovering, it can be a double whammy. So patients just need to be aware of that.
This question is so perfect for you. I can't even, if I dreamed of a better question, it couldn't be perfect for you. Is lipo worth it even if I'm already skinny?
I think the answer is probably yes, because it depends on what we're treating. Like there can be people who you can do finesse, kind of high definition lipo to remove fat to get a little bit more definition to show, kind of like, for example, in their abdominal contour, or they could have like a little area of fullness. Even like someone who's skinny can have a little submental fullness, and you remove, 5 to 10 cc's of fat, and it's a big change. Now, if somebody has like something where there's just nothing there, and like they're trying to have a procedure done, then that's not going to do anything. Then obviously, as a surgeon, you can't ethically do that.
Correct, but I laugh just because of their patients have different body habituses and stuff, and I do think that sometimes that liposuction is better on patients that are fit, because ultimately you're getting rid of targeted fat versus kind of liposuction is not great as a weight loss procedure. And if patients come in expecting a weight loss procedure, it's not going to occur with liposuction. Liposuction is a good adjunct to body contouring. Removal, skin, tummy tuck, thigh lift, arm lift is a good adjunct. On its own, just to have weight loss, not great. You're better off GLP-1, targeted liposuction with body contouring, skin excision.
That makes sense. All right, last one. What's the hardest surgery to recover from?
I have them in order. I think gluteal implants in the muscle.
Intramuscular gluteal implants, I agree.
Number 1 by far. And I think that takes the cake over all of them. I don't think there's any other procedure that's harder than that. Followed by some version of a tummy tuck. And then everything else is pretty, honestly, not bad from a recovery standpoint. Pretty nominal.
What about like circumferential trunk liposuction? Not bad.
Not bad. I think with the advances in liposuction techniques, you're sore, but you're not. The recovery's not bad.
Awesome.
Gluteal implants, though.
Intramuscular gluteal implants.
Not for the faint of heart.
Until Gem comes around.
We can't talk about that, but nuances are coming.
Yeah, there's some innovation coming to the U.S. finally.
All right, if you have questions like this, just go ask your surgeon. You don't spend time with your favorite AI tool. Claude is a good friend of yours, but talk to your surgeon about any of this stuff. If you're a patient of ours, reach out to us. We'd be happy to help you. If you like episodes like this, shoot us a message. We can do more. Thanks for listening.
Nice.
Till next time on the HKB podcast. Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.